It's interesting what Matthew was saying about uh, creeping privatization, because in fact, our healthcare system was designed in the 1960s as an insurance system based on the idea that you had hospitals that were quasi-public and you had doctors who were largely private practitioners, and they would charge the insurance on a fee-for-service basis. And then there was a lot of slippage. We had the Canada Health Act, which was to prevent doctors from playing both ends, from charging the insurance system and then charging the patient if they wanted treatment. The problem is, it is precisely, many people I know say, well, we need more competition, we need more private sector, more investment, because we have to have more happening in the healthcare system. And if we have more of the private sector, it'll somehow be good for the public sector. And doctors I know talk that way. It's the reverse that's true. We have too much of the system consists of a little doctor, a family doctor, especially, who has to operate as a kind of small entrepreneur. He's supposed to run a little business. He's supposed to hire people to work with him, work alone, and then charge. He has one payer as the government insurance system, but he is running a little business. What we have to reconfigure the system is we should have doctors and other healthcare professionals and other people related to healthcare working in teams, working together. It's ridiculous that we're dealing with each doctor individually, or even for family medicine, we're extremely lucky, my wife and I, that we're enrolled in a family medicine center where they're not paid per procedure, but they're paid on the basis of the number of patients that they have per year. And that would even be better if we put people on salary. I mean, we don't need more private sector. We need, in areas where we don't have private sector now, we need less private sector in areas that have always been private sector. The people who sort of say, oh, you people are crying wolf when you worry about private sector in healthcare. We've always had private doctors operating private practices. You'll build the system. That's right. And it's failed. That's why millions and millions of Canadians don't have a family doctor, because you have each little family doctor working as a little empire and a little businessman. Whereas if you had a proper team approach, and it has to be pushed, it has to be forced. But the federal government, it gives lip service to that. The group that the former health minister was a part of, Jane Philpott, was recommending that, and the federal government says it wants this to happen. It says in its bilateral talks with the provinces, it wants the money to go to reforming the primary care. The problem is that they're not really putting any pressure, and they don't really feel they can get away with it. At the same time, the provinces whine about not getting enough money, but the same problem, the Premier of Ontario, for instance, gave away billions of dollars when he abolished the registration fee for cars, mostly a privilege to people who don't need the money. I mean, the people, you'd be driving a Rolls Royce and you can have 7 Rolls Royces. Suddenly, you don't have to pay, you don't have to register them anymore. You don't have to pay a few $100s. Well, you add all that up, it's billions of dollars a year he's giving away. And then he's saying, oh, the federal government should give me more money. And in fact, David McDonald, who we've had on these panels before, said, there's a lot of money on the table there, in fact. He's the economist with the CCPA. But if you look at previous health agreements, the provinces only spent half of it in healthcare. When you analyze it, they took it, they used, well, some of it, they just gave tax cuts to people or reduced fees for stuff that they wanted to get votes for. So we have a real difficult problem here. I mean, ideally, I would say the federal government has got to be a lot more assertive and aggressive and push harder, offer more money, but say this is how it's spent. But in our federal system, where the healthcare is entirely officially a provincial responsibility, it's very complicated to do that. The people somehow have to pressure both orders of government to say, what we need is a properly organized healthcare system. And there are examples in other countries where we can see where the emphasis is on service, working as teams. The emphasis is on working as people. Doctors shouldn't be business people. Doctors should be doctors.